FID test, how to get accurate stool sample results. Are you curious about how to get accurate results from a fecal immunochemical test, often called the FIT test? This test is essential for screening hidden blood in stool, which can be an early sign of colorectal cancer. To ensure you get the most reliable results, it's crucial to follow the collection instructions carefully. Let's break it down step by step. First, there are no special dietary restrictions or bowel preparations needed before you collect your stool sample. However, it is best to avoid collecting a sample if you are menstruating or have active bleeding from hemorrhoids or constipation. These conditions can affect the test results. When you are ready to collect the stool sample, use the collection kit provided. This kit typically includes a small container with a sampling stick attached to the lid. To collect the stool, place the supplied collection paper or tissue on the surface of the toilet water before you pass stool. This helps catch the stool and prevents contamination with water or urine. Make sure the stool does not touch the toilet water. Now for the sampling technique. Unscrew the lid of the container and use the sampling stick to scrape the surface of the stool. You only need a small amount of stool for the test. Make sure to cover the grooved portion of the stick completely, but avoid overloading it. Collecting too much stool can invalidate the test. Once you have your sample, insert the sampling stick back into the container and tightly close the lid. It is important not to reopen the container once it is sealed. To ensure proper identification, write your name, date, and time of collection on the container. Next, let's talk about storage and transport. Store the sample in the refrigerator, but do not freeze it. Avoid exposing the sample to excessive heat or freezing temperatures. It is best to return the sample to your laboratory or healthcare provider within 7 days of collection. If possible, aim to return it within 48 hours to preserve its integrity. Hygiene is also very important. Make sure to wash your hands thoroughly after handling the stool sample. Dispose of any leftover stool and collection paper as instructed, either by flushing or discarding. Lastly, do not tamper with or remove any foil or protective barriers inside the collection container. If you are traveling or expect delays in returning the sample, inform your healthcare provider, as this may affect the timing of the test. By following these steps carefully, you can ensure that your stool sample is uncontaminated and properly preserved. This is crucial for accurately detecting occult blood, which can help in the early identification of colorectal cancer or other colon health issues. Always adhere to the specific instructions provided with your FIT kit and consult your healthcare provider for personalized guidance.